background information about some of the greatest musical compositions ever written. Tune in weekdays 9 to 10 a.m. and Wednesday from 9 to 10:30.
Hi, I'm Megan, host of Radio Free Saturday Morning, the eclectic music mix beacon of the Four Corners and worldwide. Tune in to discover new music and to revel in the more familiar with no rules on genre, form, or novelty. Learn more about the origins of songs, the lives of the musicians that made them, and a wide array of interesting facts in general. It's freeform radio at its finest. Hear what you rarely hear anywhere else here on Radio Free Saturday mornings, 9 a.m. to 11 a.m. every Saturday on KSJE.
KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them, whether it's a stroke, heart attack, illness, or injury. San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. Ten minutes past 8 o'clock. It's Thursday morning, September 24th. Good morning, everybody. I'm Scott Michlin, and thank you for tuning in to KSJE, 90.9 FM over the air in San Juan County. In Durango, Colorado, we're at 103.3 FM, and of course, we're everywhere from our website, streaming at ksje.com. Welcome also to our viewers who are watching this visual radio program, streaming live to the KSJE Facebook page, our YouTube channel, and this morning we're also streaming on Twitter at KSJE, so you can watch us on any of those three platforms. Coming up today, my guest in the studio, Amanda Evans, is standing by to talk with me about the San Juan County Partnership. There's an event coming up today. We'll get the details about that and some of the other work that the partnership is doing in the community. That conversation begins in the next few moments right here on KSJE. Next hour, it's our COVID-19 Community Information Program, and Megan Cullip will be joining me here. This morning, we'll get a lesson on mindfulness with my guest, Emily Epstein. She is with San Juan Health Partners Behavioral Health. That's coming up this morning, 9 a.m. on YouTube and Facebook, and a rebroadcast this afternoon on the radio on KSJE and KSJE.com. On the radio at 9 this morning, Mick Hess is going to take us roving with the arts, our weekday classical music program. This morning, Mick is featuring music from Maurice Ravel. That's coming up today, 9:06 on KSJE. And don't forget, of course, in addition to Facebook, YouTube, and Twitter, you could also connect with KSJE on Instagram if you're an Instagram person. Here's our weather forecast. A few more days of mild weather, then things cool off a bit next week, but 86 for a high today with lots of sunshine, 87 tomorrow, 86 again on Saturday, 84 on Sunday, and then beginning on Monday, highs near 80 degrees with still lots of sunshine, but overnight lows getting cooler from the 50s this week down into the upper 40s next week. I want to turn to my guest who is here with me this morning from the San Juan County Partnership. Amanda Evans is here back in Studio A with me. Good morning.
Good morning.
Thank you for being here. Lots of stuff going on for you at the partnership and the rest of the partnership staff these days, right?
Yes, always staying busy.
Staying busy indeed. And you've got an event coming up actually today that we can talk about because it's going to be a Facebook Live event, so folks can join from wherever they are.
Yes, yep, live virtual on our San Juan County Partnership Facebook page. Very
good. And this is accessing community resources in San Juan County is the community discussion that you'll be doing at noon today. And so talk to me a little bit about what that is. What type of resources are we talking about?
Sure, and so this is through our opioid misuse and overdose prevention group.
Right.
And what we started was back in June, we did one that focused really on stats and information around opioids and opioid misuse. And so now we want to kind of broaden it into accessing resources for recovery since it's National Recovery Month.
That's right.
And so we want to talk about how do you get help if you have a family member, if you have someone, or if you personally are going through something, and if you need treatment resources, if you just need resources in the community to help you get housing or different services. We're going to be talking about all of that.
Very good. And so again, the way that folks can join is just to go to the San Juan County Partnership Facebook page, and then at noon the live stream will start.
Yes.
Got it. And you'll be folks can ask questions or get their questions answered too during this event?
Yes, well, what it is we have a panel of kind of what we're calling experts from the community. So we have a consumer who's in recovery and use some of these services. We have some caseworkers who deal with helping get people services. We have just several, I think we have 5 different people from the community, one from Tota, one from Angel Peak, different areas of services and their expertise. And so we want them to share. So we've got we're going to let them talk for a few minutes, and then we're going to take questions from Facebook users.
Great. But it sounds like your panel is kind of set up with people that have been maybe through this already, and so they can maybe provide some of their personal experiences then on how they've been able to get a hold of these services or what they found that they needed, maybe that they didn't think they would need until they got into it.
Right, and that's kind of how we tailored the June one. Anyone who's interested, it's still on our Facebook page. You can go back and look at that video. Is we had different people from different perspectives. So for that one, we had like an ER doctor. We had someone from a treatment service. So they were able to give a different perspective on these different questions that got asked. And what's great is we're going to do the same thing. So we've got someone, who's been in recovery, who's dealt with that personally, and then we've got someone who's spent, maybe the last 5, 10, 20 years for some of these people helping other people get the services. So that's they've all got different perspectives, and so they can all kind of answer these questions from their perspective.
Right. And I know you and I have talked about the opioid problem before, and so it's still an issue. It's still a big concern here, is it not?
It
and
is
a problem here.
It's a national concern. It has been for years. I was just looking at some of the data last night preparing for today's event, and looking at from San Juan County in like 1999, we had more than doubled the number of overdose deaths due to drug. Now, not all of those are opioids, but a lot of times they're, 2 substances involved, and sometimes it's opioids and maybe alcohol or another drug. And so really, opioids is kind of the focus because it's become such an issue, but we're also talking about any other issue. If you have an alcohol issue, if you have an issue with other kind of prescription drugs or non-prescription, we want to help anybody with those. And so that's kind of the first step, is getting information out into the community about how they can get help.
Right, because it seems like when we talk about addictions, those are really powerful problems to overcome, whether it's opioids or alcohol or other types of drugs or whatever the case may be, and this is what we're talking about, right?
Right, there's a lot of different options. So some, there's medical assisted treatment for people, there's counseling, there's all these different options, and a lot of them people don't even know about. Until I started doing some of this work with the opioid group, I didn't understand all the different medications that can help with these addictions and all the different options out there to get help. And so that's what I really want to get out in the community, is how much help there is for someone who's dealing with this, for someone who's dealing with a family member who's dealing with this. There's just so much, there's so many resources, and that's kind of why we wanted to focus this one on accessing the resources.
Exactly. And again, maybe folks may not think that we have as many resources as we do have here in San Juan County. Maybe they think they're only available in larger communities, which may not be the case.
Right, and we don't have every resource available. Sometimes people do have to go outside of San Juan County, but we just had Ideal Options, who has been working with us. They just opened up here in the last few months, and so we have other treatment providers. We have a lot of counseling services. We have Tota, that's a great resource for the community. So there's all these things that people can access to get help or get referrals if they do need to go outside of the community. And I just think sometimes that's what I've heard for over the years is people don't know where to go.
Right. But this will help them to find out where to go.
Yes.
And how to get there.
Yes.
This event today. And again, for our radio audience, it is happening at noon today.
Yes.
At the San Juan County Partnership Facebook page. And so you just log on, and the live stream will start, and you'll be there ready to go, and you can ask your questions and listen to the panelists and hear from some of the other folks who are asking questions as well, but all talking about accessing community resources here in San Juan County when we're talking about opioids, but also just overdoses and other types of addiction.
Right. And you can also, if you're not sure you're going to remember at 12, if you go to our partnership page right now, we have an event listed for it, so it'll give you a reminder when we start.
There you go.
So that's a great way to kind of, in case you think you'll forget in the next
True.
few hours, because life gets busy.
Well, yeah, and it's 2020.
Yes.
So anything else could happen between now and
Yeah.
noon. It's just one of those times. But
Exactly.
I
So-
understand. But you've got it all set up, and so folks can like the event or say they're going to attend it, and that will give them a reminder.
Yes.
Facebook's good about that. So,
Yes,
so there you go.
Yep.
And I know when we talk about this type of addiction or any type of addiction, it's really hard to break that, and it takes time. And we live in a society, a microwave society, as I call it, where we kind of want things done in 30 seconds or less. And addictions are really tough to beat in a short amount of time. It just does take time, because like any habit, if you're changing that, anyone will tell you it just takes a long time to try to break that habit and break those types of dependencies that we have if we're addicted to some substance, whatever it is.
Right. We're used to a culture where Amazon will send you your package next day.
Right.
And most of life doesn't happen like that. So yes, dealing with addictions or, mental health issues, none of that is something that gets fixed overnight. And so, one of the great things, the Mental Health Task Force this month has actually been highlighting recovery stories. And some of those, they've tried to find different lengths of time people have been going through it. So they have this Dimensions of Wellness campaign that they've done, and you can go onto the Mental Health Task Force Facebook page and find that information and see those videos. But, some people who have been dealing with recovery for, a few months or a couple years, and somebody who's been dealing with it for 20 years. So there's all these different steps in between, and so hearing some of those stories can be really help somebody who might think, I'm starting out and this is never going to happen, but it can.
Right. And a shout out to all those folks, because it takes a lot to put yourself out there, to share those sometimes very personal stories of how you've overcome that addiction, and maybe you didn't do it the first time you tried. There may have been a couple of setbacks along the way, but they're here to tell their stories, and kudos to them.
Yeah, it's very inspirational and very wonderful to hear that we have people in the community. And what's great is a lot of those people go back to help other people. It's not like, they're just dealing with their own recovery. I know very few people that I've talked to in kind of the world I am, because I work in the nonprofit, that a lot of them have this story, and that's why they get into what they do, is because they want to help other people. And so it's so great that they're willing to be that inspiration, and willing to, even asking somebody to come on the panel today who, they can tell me no, but they want to come on and help other people.
Right. And this topic is something that the San Juan County Partnership has really been working on for a number of years. I mean, you and I talked about this for a number of times that you've been here, and it's just because it's so very important, and it really impacts, this opioid abuse and misuse and addiction. It really kind of cuts all socioeconomic and ethnic and other barriers, right? It affects everybody.
Yeah, there's really not a type or a certain person who's going to be affected by this. And what's so hard about especially opioids, because most of the time they're started as a prescription drug that your doctor's giving you, you
Right.
think they're safe. And so it's like, well, it's not going to harm me. And so we want people to be aware that there are risks. And we're not saying that all opioid use is bad. If your doctor and you have talked about it, have prescribed it, there are cases where it, we don't want to take away someone's pain medication that is helping them, and, they're working with their doctor on it. That is not what we're about. We've had some people on Facebook who have said that, like, I can't get the drugs I really need now. That is not what we are advocating for. What we are advocating for is safe prescribing practices, so that your doctor makes you aware of the risk, and not, there have been risky prescribing practices because, people would overprescribe maybe what was needed for the procedure that they were going to have, or things like that. So we just want to make sure what's going on from a doctor's perspective and from the community's perspective is
Right.
safe.
Sure. And that's important. And I think doctors have taken some responsibility too in all this, to educate themselves and to maybe understand how highly addictive these substances can be. And maybe there's a different prescription, a different something that they could prescribe, treatment plan they could prescribe that's not opioid-based that maybe have the same results, and they're trying to maybe prescribe that in more cases. Now, for some patients, it may be you need this particular opioid to get better, to help you with your pain management, all those different things, but there may be other options out there that now doctors are educating themselves on so that they can have some choices when it comes to filling out that prescription.
There are, and that's what's great about a project we're working with it's through the Center for Health Excellence out of, it's in New Mexico, and what they are doing is offering what's called academic detailing to physicians and to people in the healthcare field that might be either prescribing opioids or working with a doctor who is. And what it is one-on-one CEUs. So doctors have to get their continuing education, and this offers to where they can do it with they don't have to go attend a class and take 6 full hours to get their credits. They can do an hour here or an hour there over a couple months and get those full credits that they need, but it's one-on-one. So it's a person who can tailor, it's not just a class where we're going to tell all the doctors the same thing. Well, your practice might need something different because of your patient load. So this is where we have people who will meet with a doctor and get an idea of what their practice entails, how their prescribing goes, and then they will tailor that education around safer prescribing practices around opioids to that doctor and meet with them. They can do an hour, they can do 6 hours. It just depends on what they're looking for their CMEs.
Right. And that's gotten a lot of doctors on board to do this type of thing?
Well, it's relatively new. For here, we have not had someone in the community that could do that yet because you have to be trained, and so we're just getting it started. As I said, it's
Okay.
We're not doing it. We're just helping get people partnered with the Center for Health Excellence to do these. And so right now, of course, they're doing them virtually just because everything's virtual.
Right.
So what they're doing is they have a webinar once a month on the third Thursday where or anyone in the community can tune in and find out just kind of the overviews of academic detailing and then get connected to help promote that or to get set up to go through the program.
Right. Well, that's good to know. And good that the partnership is helping to make this happen here locally, because I imagine, again, like most things, they'll start out in the larger cities and expand out across our state. And so, again, it's important that it gets into all the corners of our state because it's a big problem. And we see it statewide, nationwide, as you've said.
Yes. Yeah, we've, and really with all the things that have gone on the last few months, we're still looking at how that's going to affect the data for this coming year. And, are we going to see a lot more overdoses? Are we going to see less? We're still really trying to figure all those numbers out, but we want to be prepared because there has been, news that it could be worse as things open back up and things like that.
Right. Well, I would think even as things are closed down, people are maybe more stressed and
Right.
dealing with more other 2020 stuff that's going on, whatever the case may be. The kids are home, maybe the spouse is home, and it's getting pretty crowded, and folks maybe are turning to other ways to manage, and that's not always the best way.
Right, and we've heard, that alcohol sales have increased, and so we're really looking at what does that mean and who is now buying it. Is it, people increasing their drinking that were already drinking? Is it people who never drank and now are? And so that's a high risk thing too, because if you're already taking an opioid and you start drinking, that's a big risk for an overdose.
And a no-no. A big
Right.
no-no. I'm not a
Right.
doctor, but I know that.
Right.
Yeah.
And so, but some people don't think about that if their
Sure.
doctor hasn't talked to them about it. And so, another thing we're really promoting is if you do have an opioid in your house, even if you're not the one using it, is make sure you have Narcan, which is able to reverse an overdose from an opioid. And so, if you have a family member who takes it, and it doesn't even have to be they took too much on purpose or something, it could be as simple as, a kid gets into the medicine cabinet and takes something. And the great thing about Narcan is it doesn't do anything if you're not having an opioid overdose. So if a kid gets into Narcan, there's no harm in it. So you can keep it in the medicine cabinet. And if you do think someone's having an overdose, you can use it on them. It's a nasal spray. You can be trained to use it. You can get it through any of the pharmacies. They have a standing order, so you don't even have to have a doctor's prescription, you can go in and ask them for it, and it's covered under some insurances. And so it's just really, if you know anyone who has them, it's really a great thing to have in anyone's first aid kit.
Right. And it's amazing. It's just how well it works. I mean, there are documented stories about, that is a life-saving treatment in cases where it's been used, right?
Yes, we've had it worked here. Our law enforcement, our EMS carry them, and so they've used it to save lives. And like I said, if it's something that's not an opioid overdose, then they can. If they use it on someone who's not, and they're not sure, it's not going to harm them at all.
Right. But I guess, again, for law enforcement and first responders, if they're coming up on someone who's maybe unconscious and can't tell them what they took, that would be something that they could administer, just thinking that it might be an opioid overdose or some problem like that, and try to revive them or what have you. And if it's not, I guess it doesn't do any more harm.
No. And the thing is, they're all trained in what to look for.
Sure.
But for someone, if you walk into a family member's home and you're not sure, they take opioids, but you're not sure if that's what it is, and you use it, it's not going to harm them. And always, we say this, always call 911.
Of course.
Even if you do use it and they come back, you want to make sure they're getting some help, because it is not a long term. They can still go back into an overdose. So that's why your pharmacist can train you on how to use it and kind of what you need to know about it.
Yeah, good point. Good point. My guest this morning, Amanda Evans, is here with the San Juan County Partnership. We are talking about the ongoing issue of opioid misuse and overdose prevention. There's an event going on today at noon on the San Juan County Partnership's Facebook page, accessing community resources here in San Juan County. Of course, it is going to be a free event, a live event on Facebook this noon, 12 o'clock. Just go to the San Juan County Partnership Facebook page and you will be accessing that. You can also like the event that's been set up and get a reminder for this happening today at noon. And I imagine, like most things on Facebook, it will be available after the fact. If people can't maybe get there live at noon, they can watch it later?
Yes, they can. And if you go to the event, you're not going to be able to watch it at noon, and you have a question you'd want answered, feel free to post it in the discussion there, and we can ask it through that, and then you can watch it later, because we want to make sure that we're getting questions that the community has answered. Right.
Very good. And you mentioned this other video that you did earlier in the summer, in July?
June. The end of June, yeah.
And that has gotten a lot of attention, right? At least according to Facebook statistics, which is kind of cool. You can kind of measure some of those things. A lot of folks have watched that or seen it, or it's popped up on their feed or what have you, which is a great thing.
Yeah, we had a really great response. I was actually kind of amazed for the first one doing it. We had a lot of people watch that day, but we had even more like in the next 48, 30, the next few days.
Right.
After that, and we've even had a few since then, because it's up on the page. It's easy to access. If you go to the videos under the partnership, it's probably the third or fourth video there. So it's really easy to get to, and it's still, all the information is still pretty current. So because it was just a couple months ago, and so it's a great resource to use.
Indeed. And again, I'm a big fan of local. KSJE is all about local. The partnership's all about local, and that's what's important, is that these videos share local information, which is great, in local resources.
Yes, we've been really lucky. San Juan Safe Communities has helped us put these videos together. Greg Allen has been wonderful to help us pull all this together so that we are able to do it all locally and have local panelists and have local people from the community sharing it to help get the word out. So it's a great. It is, you can go on and search for information on opioids, but it's hard to narrow it down just to San Juan County. And so, like that video from June has Athena Huckabee from Ideal Options was giving a presentation that talked about not just some national and state statistics, but actually went into some of the opioid statistics for San Juan County.
Which is great. And so, again, great information. Again, thanks to the partnership for making this available and putting this all together. And again, to those folks who have been talking a little bit about their stories as well, those local people, because they are our friends and neighbors. So it's important to hear.
And there's a statewide online virtual event this weekend. I believe it's on Saturday, where some more stories from San Juan County will be told as well.
Very good. Well, and before we run out of time this morning, Amanda Evans, I want to pick your brain a little bit about the U.S. Census, because I know the accurate census count is so important for things like the partnership does, some of the grants that you apply for, the programs that you offer, and things like that. It's important to know how many folks you are helping in our community.
We use it for so much of our grant writing. It helps us show, it can determine our numbers for this community, can determine whether we're even eligible to apply for money. So if we're doing a huge undercount, there may be grants that we could apply for that we won't be able to just because the numbers don't match up with what they want. And it affects our schools, it affects, so much of our life, and it's so easy. I did mine in, just a few minutes, and it's quick and simple, and there's so many people around town that can help you. If you call, some of the nonprofits in town, I'm sure would be happy to help.
Indeed. I know a lot of folks have kind of gotten together. The count, I think, right now for San Juan County, we're still under. And I think we're a little above the state average, which is good, but we're still below where we would like to be at this point in the census, because things are wrapping up at the end of the month, which, guess what, everybody, it's next week already. And so it's really important for a lot of the reasons that you mentioned, a lot of funding for schools,
Yes.
roads, other infrastructure, things like that, but things, even social services that we're talking about here, some of these programs that help people through addiction, through overdoses and things like that, those are all from population numbers.
Well, and like we use the Youth Risk and Resiliency Survey, and what it's showing is, we've been doing alcohol prevention long before we even started with the opioids, and especially around youth, and it's showing a decrease in alcohol use among youth in our county, and that is from some of the programs, not all just partnership programs, but we have community-wide people working on this issue for years. We have law enforcement, we have county people, and all of that kind of services will be affected. And so it's really concerning that we could see numbers go back up if we don't have the money to provide those services.
Right. And again, that's a good point. And congratulations on the good work that the partnership and the others are doing. And it's showing some positive results. And I think that's important. And I don't know if the public always hears that. They hear it here because we talk about it.
Right.
But it's important to remind them that these surveys that you're actually asking the kids that we're talking about, and they're hopefully telling you an accurate answer,
Right.
that they're not using alcohol as much as maybe kids a decade ago.
Right, and the great thing about some of these surveys is they are, they're scientific, so there's ways to make sure they're,
It's accurate.
Yes, it's
Yeah.
accurate and things. So we really are seeing some changes in behaviors in our youth, and that's because we're able to provide some of the services we are, and because the schools in our county have great programs and things like that, and that can change if we don't have the funding that's able to come. So again, the census is so important to fill out.
Very much so. 2020census.gov, everybody, if you haven't already. If you know some people that have not, please remind them, because time is running out. As we mentioned, the census will wrap up on September 30th. The local San Juan County Counts group has been doing a great job to get information out and to get the census going. So we just leave you with that reminder today. And the other reminder about the Facebook Live event today at noon on the San Juan County Partnership page. Again, accessing community resources in San Juan County today at noon. And again, it'll be there after the fact. But if you have a question, you can certainly put it on the event, and they can ask it at noon if you're not available.
Yes.
Very good. Amanda, thanks for coming in this morning.
Thanks for having me.
You're very welcome. Always great to talk with you and the great work being done by the San Juan County Partnership. So we'll see you again in about a month.
Yep. Thank you.
Okay. You're welcome. Amanda Evans, my guest here on KSJE. Back with more in just a moment, everyone. The time is coming up on 8:37. San Juan County, we need you. This is Scott Michlin. As a longtime resident and advocate for our community, it's so important to fill out the 2020 census, so all of us here in San Juan County can be counted, because we do count. Take 10 minutes and fill it out today, and tell your neighbor too, so we can get our fair share of funding for our health, our education, and things as simple as our roads and bridges. As the deadline is nearing, make sure you get counted and benefit our wonderful San Juan County. Complete the census when you receive your invitation, or visit 2020census.gov.